associate at London School of Hygiene and Tropical Medicine, researching greenhouse gas mitigation of healthcare systems and its relation with adaptation in the context of climate change. She's a medical doctor from Netherlands with a master's degree in global affairs from Tsinghua University in Beijing. She has attended the UNFCCC COP25, COP26, COP27, and the first ever UN Youth Climate Summit to advocate for planetary health. She is the first next generation steering committee of the Planetary Health Alliance. She has represented medical students worldwide to the World Health Organization from 2020 to 2022, during which she helped set up the WHO Youth Council. She now continues to support youth engagement and the council as part of the WHO Health and Multilateral Partnerships team. Iris, with this, I give you the floor.
Well, thank you so much, and hi everyone. Super glad to be here and talk about this important topic with you today. During the duration of the event, there will be a Mentimeter up here, and I encourage you to share your answers whilst we're in the event. And if you come up with a new word, add a new word on there whenever you want. And I also encourage everyone that's speaking, sometimes take a look if you wish, to see what everyone is answering to these questions. And thank you so much for joining us today. I think we're at a very exciting moment when it comes to youth engagement. There's a lot of momentum, especially in global health. So we're going to take a deep dive and we're going to learn from what we have seen around us when it comes to youth engagement in global health, and learn really from the experts, from the youth that have taken major steps. And I hope that we can also learn from you, because I think when I'm looking around, there are a lot of young people here that are doing some incredible things. So do feel free to interact, to teach us about what you're doing, to ask your questions. We also want to learn from all of you. So thank you so much for coming. Before starting us off, I would like to give the word to Sam from the University of Geneva. He's a medical student here, and he would just like to welcome us. So Sam, go ahead.
Hello, everybody. My name is Sam, as Iris said. I'm a medical student at University of Geneva, and we are happy to have you here. We're happy to co-host this event, the side event for WHA. We hope that everything goes well, and yeah, enjoy.
Thank you so much, and thank you for hosting us and making this all possible for us today. All right, without further ado, I am honored to introduce our first keynote speaker of today, who is Dr. Gaudens Silberschmidt. She is the Director of Health and Multilateral Partnerships at the World Health Organization. Gaudens, I pass the floor to you.
Thanks a lot, Iris. Thanks a lot all. Welcome. Big thanks to start with to Doreen van der Waal, who supports me together with Iris in the team to make those things happen. Looking at you, it seems to me some of you will know everything I will say, some of you won't know, so I'll adjust a little bit and also want to see from you who knows what, and hopefully also from those on the screen. Let me see if I can see them. Because I want to speak of the use of the different initiatives that WHO has to really fulfill what Dr. Tedros is very strongly committed to get youth engagement meaningful and much more. So it's the quantity and the quality that we are strongly working on as a team to improve. Who of you has heard of the Youth Council? Who of you is involved with the Youth Council? So several of you, and you can, where is Walter, kind of depict how many in the room, you think how many times on the different picture here. You will get quite a few. But basically the Youth Council is at the center of our engagement, where we brought together 22 youth and very, very young, isn't it, Marie? Participants, that was the youngest one participating in the Youth Council, from 22 organizations. We really went global, diverse, health-related youth organization, non-health-related youth organization, different backgrounds to really get them helping us and advising ultimately the Director General on how we get better in the engagement. And they will also be the ones co-developing with us a youth engagement strategy. So if you think something that, why isn't WHO doing this or that? Approach one of the youth council, especially Hamayal, my vice chair on it, and tell them, make sure that we get this into the youth engagement strategy, because it's not just Dorin Iris and me with WHO staff writing it. It will be co-written together with the youth council, where we really want to shape on how we can get stronger in the youth engagement. And probably Hamayal will tell you a bit to what extent Dr. Tedros took half of a Sunday out to really engage with the youth council and really listen, not preaching on what he knows and thinks we should do, but listen on where we should go. We had also, thanks to Dorin, launched the first global model WHO. Who has been involved in that one? Or who has heard of it? Many of you involved less because that's slightly younger participants, but basically a successful collaboration with the World Federation of the United Nations Association, with 8 Committee A simulations, 30 side event, 250 participants, and bringing proposals of resolutions. So basically that young people can see on how this craziness of a World Health Assembly actually would work, and can get the feeling of, why is that other delegate not giving in immediately? Why can't I just get everything I want? But how does multilateralism work? One interesting experience we were told when we signed the MOU with the World Federation of Public Health of United Nations Association, where one of the young members of them was saying, look, as a high school student, I went to Model UN. Actually, it was another girl which made me go because I was interested in her. But now I'm interested in multilateralism. So it's really a tool to get people understanding, and we shouldn't underestimate. Most of you know that, but many others don't. The rules of procedure of the World Health Assembly are not the same as the UN General Assembly. New York kind of negotiations are not the same as Geneva kind of negotiations. So it's the first time we have been shaping with formal WHO input. There have been ad hoc other mechanisms, but with formal WHO inputs in collaboration on such a model WHO. Then, and Iris is pushing that very strongly, the WHO Youth Delegate Program. Who of you is member of a national delegation? That is a clear increase, and going forward. So we have now, and we actively encourage national delegations to include youth delegates in their national delegations. We have 17 youth delegate, 17 delegations with youth delegates in it. Yes, you can record it. And that's a clear increase from the previous years, where we had only half or less of that, and we want to go further. I should mention here also, for the strategic roundtable during the Health Assembly, we made a deliberate choice not to say, oh, there should be a discussion on youth engagement, because that one we can do here. We didn't want to discuss youth engagement, we wanted youth engagement. So we managed to have a youth and or a civil society delegate representative on each of the strategic roundtables. We want you to participate in the content discussion, and not only to say that you should participate. Of course, there are still delegates who need to hear that you should participate, but ultimately we have to lead with the example that you actually participate directly. We're also working, or our human resource department is also working to strengthen youth engagement. Dr. Tedros made sure the internship program gets much more equitable. Earlier, it was the usual same strong and rich universities from rich countries with rich students who only could set interns. If you ask me, oh, can I come to intern with you? My answer will be, sorry, you have to apply as a director. I cannot simply choose from my side. You have to apply through a competitive process, and participants from low and middle income countries get a stipend allowing for the cost of living in Geneva to really get involved. I would also encourage not only to apply for Geneva internship, but we have our 6 regional offices. We have our 150 country offices. That gives also a very, very good and important experience. We have the JPO program, Young Professional Officer program, where basically several mostly high-income countries are paying for young professionals to get as staff members for 3 years in the WHO. And that has been recently complemented by the Young Professionals program, which is the same for low-income country. We still have to push that the middle-income country have also their opportunities. We have the initial discussion with some to get them in. That's then really the career program to get people really work exposure. The way that those ones work is 3 years paid as a full staff member in WHO. If you're good enough, you will get recognized that people will look for you, and then through a competitive selection, many of the JPOs are staying. I know some who ended up assistant director general, one ended up even running for director general. So quite a perspective when you start in the JPO program. And then we were working on the global youth mobilization, which just concluded its first 2 years round, where we were working with the big 6 youth organization, Boy Scouts, Girl Scouts, YMCA, YWCA, Red Cross Federation, and Duke of Edinburgh Award for local projects. And they are looking into going into a second round for they had several hundred projects in 80 countries around the world, which were financially supported and are now fundraising to go for a second round of really engaging young people directly. What I liked in that project was first time I've ever seen that any project selected, no person above 30 years was at all involved in project selection. So the panels selecting the project which were funded were run by young people who were selecting which were the best project, which were then implemented. Go at Global Youth Mobilization to look at their impact report, which is quite amazing. Doreen, have I forgotten anything? Thanks a lot.
Amazing. Thank you so much for opening this event with that incredible keynote and the overview of everything that's happening. And as you might have noticed from the speech, a lot of these things are very recent developments. So that's very exciting, and it's something to keep an eye out on as doors will continue to be open, including through pushing by the Youth Council in this space now. So thank you for that overview. I would also like to recognize the presence of Clara Greiner, who's a health research project manager from the Botnar Foundation. So thank you, Clara, for joining us virtually today and for your dedication to young people as well. So now let me move on. I just also want to make a note that today we're doing things a bit differently from what you might have been doing for the past week. So we really want engagement. We're not reading, 30-minute statements from a piece of paper here. We're really trying to get engagement. So if you do have a question that comes up or you have a reaction to anything that's being said, just raise your hand and we open the floor for you. I also think it's very interesting what we're already seeing on the screen. There are some things that I don't even understand, like deepism, but maybe someone can explain that to me. But I do think it's really, really impressive what we're seeing. Things like diversity is really big on there, collaboration, innovation. So this goes to show all of the value that young people can bring to this space. So keep on answering whenever you would like. Now I'm honored to bring our panel forward on the stage with me. I will introduce them one by one, and then we'll go through some questions with them. So I will start with Ctre. Katja is the manager on youth health issues at the International Youth Health Organization, and she's on the WHO Youth Council. She has an impressive history in global health. She previously served in key positions with the IFMSA, with the Global Health Workforce Network Youth Hub, including in the steering committee, and she's worked for the Slovenian NCD Alliance. Her expertise spans NCDs, environmental health, health policy, and youth engagement. And we are very happy to call her this year at the World Health Assembly the first Slovenian youth delegate. So Katja, thank you so much for joining us. Now I would like to call forward Kamaya Sarna. She is a liaison officer to the World Health Organization at the International Federation of Medical Students Association and the Vice Chair of the Youth Council, as we already mentioned. She's a Paul Farmer Global Surgery Fellow at Harvard Medical School, and she has distinguished academic and clinical background with experience as a research intern for the US Department of State and a contributor to major health journals. Her work demonstrates a commitment to equitable, accessible health and particularly surgical care. Her interests lie in health policy, economics, striving for global health system strengthening, and universal coverage. Thank you for joining us today. All right, and we'll move on to our third speaker, Audrey Wang. Audrey is a acute care pharmacy resident, chairperson of public health of the International Pharmaceutical Students Federation, and also a member of the WHO Youth Council. She is a vocal advocate for youth in global health, leading the Global AMR Youth Summit. She focuses on public health issues like antimicrobial resistance and climate change, with roles in the Young Health Working Group and the World Food Forum's Youth Policy Board. Audrey aims to ensure youth representation in global health discussions. Welcome, Audrey. And last but not least, I am happy to welcome Balkis Abdelmoula. She's a medical doctor specialist in family medicine, and she holds master degrees in environmental public health, health economics and management, and data analytics and biostatistics. She's currently serving as the medical education officer for the World Medical Association Junior Doctors Network and a global health consultant. She combines research and advocacy to promote the rights and highest standards of health and universal health coverage. And with involvement in various youth-led initiatives and NGOs, since 2011, she effectively prioritizes advocacy issues and understands the importance of government and non-state actor engagement in addressing urgent matters like climate change and health. Welcome to you as well. All right, so now I'm happy to open our panel with the very first question. And I will ask this question to each one of you. Could you each briefly define what youth leading and partnering for health means in your respective fields? And why is this of paramount importance? Ctre, going to start with you.
Sure. Well, I don't think if there's like anything new that I can say that everyone else in the room isn't already aware of, because obviously we are all here because we understand and know that youth leading for health and partnering for health is something that is not just a suggestion, but it's an actual need and an actual want in order to bring about a sustainable future. So in my personal reality, and I know that Iris read through a lot before on what I'm doing and so on, but it's basically something that is with me every step of the day, because I work in a youth organization. So that means that I work with youth, I work for youth, and I have been doing that since practically high school. So it really is something that becomes sort of like second nature, a part of your existence. And you see that it is really important that youth is present and has a voice, because oftentimes youth as the voices that are either silenced or silenced. And it is important that we are the ones to bring that to the forefront and really make sure that those vulnerable young people that are either facing difficulties in their day-to-day life, in their health and so on, are a part of decision making, because only then we can find the solutions that will actually matter for the future, and that we will address the need for everyone, so that we can address what also Dr. Tedros was talking about this whole week, which is health for all.
Thank you so much. And Hamayo, can I move to you? Do you have something to add to what Ctre has mentioned, some other perspective on this question of why is it of paramount importance, and maybe particularly in your field?
Well, it's hard to follow up after that because Katya summed it up very well. But I would say that as medical students, we are very much involved in consuming health and also witnessing health and spectators of health. But what has been missing in this narrative is how we are also the providers of health, because in our years as medical students, we are basically gunning to be on those leadership positions in our hospitals. You can be the leader in your clinic, or you could be the leader in your hospital, you could be the leader in your community. But basically, these are all things that culminate together into you shaping how health is provided to people who need it. So I think it is very paramount that from the time we are involved in these spaces, as we are getting educated in how to be doctors, we also need those opportunities to be how to be good leaders and how to be on those tables where these decisions are being made. So I think youth engagement is at the root of every single initiative, be it health or non-health. And as medical students, I'm very pleased that we have many strong organizations that help us to form a one voice and gun for that and basically advocate for that. But basically, I would say at the root of everything, youth engagement is paramount for everything. Yeah.
Yeah, sorry, I just scraped after the sometimes that happens. No, thank you so much, Havaya, for your intervention. And with that, I would like to ask Audrey, you have a lot of expertise, especially with pharmaceutical students. What would you like to add?
I would definitely echo with that as well. I think like the main thing is that we are also the providers of health, especially for pharmacy students. A lot of us actually work at a community pharmacy, and a lot of times we say that a community pharmacist might be the most accessible healthcare workers. So people might actually come to us before they go to doctor, try to figure out if there's any way they can do it on their own before they reach out for more help. That means that it is very important that we actually understand what is going on, that we are a part of that decision making. I think it's also very important because we want, like, for a sustainable future, other than just us being involved in the decision making, is also about how we get the experience, and then we go back to the community with the youth community, and actually we train the next generation as well. It's about like you getting the experience and then you pass on experience to the next group of people, and then how we can continue to use this experience and all this knowledge, like sharing here, and then to scale up all of the actions that we have in the local level, because what we have after the decision is how we can bring it back to actually have this grassroots activities.
Yeah, thank you so much. And Bacchus, you have some different experience than the other panelists, as you've been active also within the junior doctor space and so on. What would you like to share on this point?
Well, actually, the Junior Doctor Network is quite a platform for junior doctor voices to be in use for youth engagement in the WMA, which is the World Medical Association I'm part of. Before the existence of Junior Doctor Network, basically it was predominated. It was probably dominated by senior doctors, but now with the youth being part of its work, we are even representing it at the WHA for quite several years now, and it's been quite I think an achievement in the field of youth engagement. And by this platform, we are also empowering the medical doctors to the undergraduate people to be part of the next next phases of what WMA might look like. So through this partnership with IFMSA and other engagements we have in common, and webinars and other events we collaborate in, it's quite an impressive, a fruitful thing we can make to make other people from both the medical field, pharmaceutical field, and all the other young people platforms be involved in decision making. And not only decision making like on a governmental level, but I would say also on their institution level, in their research programs, in their advisory boards. For example, while I'm concerned with medical education, it might be interesting to be part of how medical curriculum is shaped. So we have a seat and we have a say in those things, and it's not just
we wait for someone to have our opinion, but we have to create the opportunity to give our opinion, and we have to be trained and have the skills to advocate for what we have to say. The issues you would like to learn about, such as mental health, for example, is quite for now absent in our curriculum. That would be an important thing to add into our education as like future physicians or current physicians, as I am and my junior doctor network colleagues. Yeah, that would be my additional part for this question.
Thank you so much. I think that's super interesting. It was very interesting to hear from all of the different perspectives of why is it important. And I'm wondering, I'm going to move on to hear some specific examples and experiences that they've had within youth partnering and leading for health. But before we move to that, on the why, on the importance of meaningful youth engagement, is there anything that anyone thinks in the room or online that we haven't put on the table yet? Any other reason, any other perspective that you would like to share on this question? Or they were so clear that it's all there, which is also great. Cool. All right, that's great. So wonderful. Thank you for so clearly underlining the importance. And I think, as Katja said, we are here in the room. Most of us are very much aware of this, but I hope this also, again, helps you understand from different perspectives and experiences how you can voice that importance to other actors and while you're advocating for meaningful youth engagement and talking about the topic. So now let's get to some experiences. I would like to start with you again, Katja, on that end. Could you share in your specific role or the roles that you've had, how you've championed and advocated for youth partnering for health, and are there some standout success stories that you would like to share in that?
Well, I can share a couple of short ones. So the first one, perhaps the one that also brought me to this moment, being the national youth delegate, is basically trying to advocate towards Slovenia as a member state to finally start bringing youth to the table. Fortunately, because Slovenia is a very, very small country and we enjoy quite a lot of support from certain leaders in our Ministry of Health, we had very good channels of communication when it comes to that. However, I still remember when I was in here for my very first World Health Assembly and here as a delegate of IFMSA, I was running around trying to figure out who is representing Slovenia, who are these delegates that, you know, like you only see their written name on the provisional list of delegates and so on, and then Googling their pictures so that you can catch them when they finally step outside of either Committee A, Committee B, trying to see like what happens. And then finally, after like probably about 10 emails or so, the secretary that was a part of the delegation replied, and she was like, oh, I have like 15 minutes now if you want to, you know, catch me for a coffee at the Serpentine Bar. So I went there and came armed with a policy brief on why are youth delegates important for member states. And we ended up, instead of like 15 minutes, we ended up talking for an hour and a half. Of course, things didn't happen as fast as we wanted them to go, because before me, there were other Slovenian delegates, of course, during other WHAs who tried similar things. But, you know, like every year that you remind them that you are there, that you exist, and that your voice is important, it will bring their attention like that much closer to where it needs to be in order to actually get something done. And then we started, you know, not just like talking with them around the WHA, but we started emailing them about like national initiatives, and then how does that connect to like regional and global health and things like that. And, you know, bringing up our achievements from the organizations that I've been and so on, pointing out what youth has been doing in the global sphere has been really, really successful. And they are, you know, so proud of us that now they are actually giving us a spot on the delegation. However, now we have this daunting task of actually figuring out how the youth delegate program will actually look in the future. So that is one example. And it's basically like, don't give up, just, you know, like annoy them to the bones basically with your emails and messages, because you just need that one person that will start listening, and then the awareness will start spreading as well. Then perhaps additionally is one such thing that, of course, like one success is the Youth Council. And this has probably been brought about by generations of young people from both non-state actor sides, youth delegates, and so on, that have been pushing for a formalized space within WHO for youth voices to exist. And while this idea might have looked very different 10 years ago to the youth that was advocating for something like this then, but it really has been a success, seeing like how, you know, what every single person did sort of like piled up, and then it came to fruition as to what we have today. And we're also seeing regional youth networks come alive. The European region of WHO just opened their Youth for Health network as well. And we were lucky to be a part of that. So, you know, try to push for your regional offices to do that as well.
Yeah, thank you so much. Super interesting to hear about those success stories and what has grown in the past. And congratulations once again on being first of being a youth delegate. I think it's very exciting. I think it's also the first in the region, if we're talking about sub-regions within Europe. So that's also then again an inspiration for the countries around Slovenia. Super exciting. So Balkis, maybe I can move to you right now. Do you have a success story to share with us in the space of youth partnering for health?
Yeah, for sure. Maybe it's not the similar situation with what is happening in Slovenia, but I hope that it would be the case for other people, younger people from my country, Tunisia. So when I was back in like 2018 as an IFMSA delegate, it was my first and last IFMSA participation in the WHA, and then like after a few years last year with the WMA, there's like quite a difference in the approach to the government we had. So like it's like there is progress, but it's going like in a very slow way, given in like the political situation back home, because we don't have the same government over the years, so it's quite unstable. Maybe that would be like the challenge to overcome. But once we have the new delegates from like our different networks getting together, for example, I've already started talking with like Cyrene yesterday about drafting a note to and an action plan to our minister, which she will be meeting tomorrow. So that's something like I hope would be fruitful. But on another side, I've been happily involved with the Global Health Strategies company, which is like an advocacy company that works on different platforms. And one of the platforms is the regional one, where we get together stakeholders from many areas around immunization, for example. And for this one, there would be like mainly senior doctors, but once I was part of that coalition, I tried to make sure that also young people are part of this like community and they have the opportunity to be vocal about what they think is more important when it comes to vaccination or their countries in the MENA region. And that was quite a success, I think, after a few months now. And on another side, also when it comes to research, involving young people from the stage of being a medical student and getting to know how research is done and getting involved with the different teams in the university is not actually quite accessible back home. Maybe it's a change to know, but it's not something accessible until you finish your specialty, actually. And you have like so many opportunities you can do before that, but you are not allowed to, because they are like there's like this standard that you're not qualified enough. But no, we are qualified since the beginning, and we can be learning, and we know about all the research steps and how to publish and all these things. And what I did is what we do on other platforms, but on a national basis, to get people involved within research units and to make them more familiar with how things go, how the institution is organized, to make them have a clear idea about how things work on an internal way, so that they know how to enter themselves in it and be a stakeholder within other stakeholders. So that's my experience in a nutshell.
Amazing. Well, thank you so much for sharing that, and also the different facets in which you have engaged with those opportunities. So I will ask everyone to just quickly stand up. And now we'll sit down again. All right.
Yeah.
I hope you enjoyed that. Also, what I forgot to mention, and I will underline this. First of all, thank you for everyone joining us online. Second of all, thank you all for traveling so far to join us here in person, because I know it's not close. Now, Audrey, I would like to move on with you. I'm going to slightly tweak the question that I just asked to Ctre and Bacchus, and I'm going to ask you, what have been the most successful strategies or initiatives that you've seen implemented in developing and mostly also sustaining youth leading and partnering for health?
Mhm. I think like you, when we think about strategies, we probably think about, oh, like who do I reach out to? There are like step by step, like 10 steps to like figure all this out. Instead of doing that, I would say if you have an idea, just go for it. So for example, during COVID, actually for FMSA, IPSF, IPSA, IDS, maybe you know, and we have an alliance that's called World Health Students Alliance. That's when we kind of start thinking about doing this global AMR Youth Summit. It's very interesting. It's virtual, and then we just kind of think about it. And of course, the first year, we don't know each other, but like we try to like, you know, plan everything that we can with like the online platform. It went very well. And I think like we actually attracted some partners as well. So like last year, 2 years ago, being the second one, I saw that there are a lot more changes. We can bring more like high-level speakers. And until this past year, we actually have a WHO AMR team on board as well to continue to, you know, scale up all this. And then they also help us find speakers too. So it's like more and more attracting more partners being in there. So in the group, we're able to reach out to like speakers from UNAP or like speakers from animal food. And actually after the Global AMR Youth Summit, since we were just like, let's do it. Mark, we probably know we didn't have a lot of time. We just say, well, it's going, it's happening. So we only have 1 month. It's happening, whatever, what. So we spent so much time planning everything. And I think that this strategy is to just go for it. It's very happy that people recognize what we did. And after the collaboration with the UNAP in this Global AMR Youth Summit, it's the first time they actually were asking us, we want to send youth delegates to the third edition of the AMR ministerial meeting. They were helping us along the way. We had a lot of challenges, not getting approval and all this, but they worked really hard with us that they actually ended up bringing those 3 youth delegates to the meeting. So I definitely say with the strategies, just, you know, you have an idea, you go for it, and it also unite with the other youths to have that voice.
Thank you, and congratulations on that. That's incredible to hear how it has developed and what else it's catalyzing. So thank you for sharing that. Hamael, can I ask you a bit of the same question? Do you have some perspective to share, something that's sustained across time when it comes to meaningful youth engagement?
Of course, I would say that I would just like to endorse this. So we have the IFMSA Youth Pre-World Health Assembly, which is basically one of the ways in which we bring young people like you who want to do an impact locally or nationally. And I would say that the person who came up with the idea was one of a kind, because at that time we didn't have something like a young representation that was so big that would come to assemblies like the World Health Assembly right now or any other high-level meeting. And the idea was just that young people be present, but it evolved from that, and young people became engaged. And engagement is something that is different from presence. So presence is basically you just going there and not interacting. But we saw over the years that IFMSA would bring somewhere around 40 to 60 young medical students to these high-level meetings, and they would all go back home with ideas. And then we started with the National Youth Delegate programs, in which these young people started talking to their ministries, to their permanent missions, and they saw that how impactful they were, because you do not simply become a part of the delegation that is of this level to be representing so many medical students to World Health Assembly. So that gives that level of prestige that would make a lot of member states look at these delegates very in a different light. So we were very thankful from that for those innovative minds who came up with the idea to first put something like this on the map, and then also propel those young people to be bold enough and brave enough to reach out to their member states. But what had been lacking, I think now we are talking about, we evolved from presence to engagement to now being as equal leaders or partners. So what has evolved over since the time when we used to bring the delegations to Geneva every year is having an establishment like the Youth Council. So basically, Youth Council could be said that it was just a lot of advocacy that was done in all of our constituencies like IPSF, IS, WMA, JDN, and YHO. Like all of these things were happening and propelling towards this message that young people need to be involved. But then we had the institution of Youth Council. And I was just talking to a colleague earlier today that since its conception in January and until now, we are seeing like an exponential landsliding of national youth delegate programs because the level of support and credibility that you get by working together, by being in these spaces is just paramount. And now we are seeing the evolution of young people's role from not just being engaged, but as partners. And just during this Youth Pre-WHA, we saw so many of our members within our delegation to be involved in these permanent missions. And it just gives us so much hope that in the coming years, yes, we will have what we are doing right now. We will keep continuing that, but we will also have support from the member states and from entities that can support young people to grow even more stronger and more involved in these roles. So I would say, yes, we all have opportunities, but it just comes down to your support systems and innovative minds who just tell you to do better. And there's always something more to be achieved.
Amazing. Well, thank you so much. And I think there lies a strong call to action in there as well for any member states that might be in the room or those that are closely connected to member states with regards to the support and opening doors for young people. I want to move on to the next question, but before I do that, is there anyone in the room that would like to share one of their experiences when it comes to youth partnering for health, something that you have done, accomplished, or you have seen around you happen that is inspiring to you?
You can come take the chair.
Maybe kind of a since we're all gathered here, I think recognizing the fact that those who are gathered here have a certain level of privilege, and that when we're building those partnerships, we have to think of how to spread it out. And this goes back to how we set up the youth delegate program in Canada, because we kept harassing them over and over again. And I think that one thing that convinced them at some point, we were chatting about this for the fifth time, and we're like, well, we're already here. We have access. It's quite easy. I'm not doing it to set myself a way of access to the space. We're already in this space and we already connected to networks. But we're doing it because there's a bunch of other youth in Canada that don't have it next to another official relationship. I think that convinced the person that it's not. And 6 months later, we had a youth. So there are sometimes like certain things that we'll say that click with people and that happen to be there at that time. But I think it's worth thinking about it when building those efforts to build them in a way that gives.
Yeah, super important point. Thank you for sharing. I see one hand up there. I might ask you to maybe come stand here so that the people online, I hope they heard Yasin, but just in case.
Maybe stand up now.
I just wanted to share a short notice that you can also collaborate. I know that at least a lot of the European countries have youth delegates that they send to UNGA and other areas like the other meetings or commissions, CSW and so on. And you can also push that way to already have a good example of a youth delegate and how that works, and then try to just get another official one. That was a short notice, but of course, and it's a shame, there's a lot of countries who don't have that privilege, but we can also push for that.
Yeah, thank you so much for sharing. And maybe I know you, so I forgot to ask, but just so that everyone in the room knows who just spoke, so that's Yasin from Junior Doctors Network. And then we have Sophie, who is actually a Danish youth delegate. So I saw some other hands, I think. Yeah, then please come over here. And if you could also quickly introduce who you are.
Okay, so I'm Danny, one of the Lebanese youth delegates. So one thing I want to say about how to be involved is that just aiming for to be a youth delegate is not enough. Before doing that, you have to be present at least, or to collaborate with your governments or ministries on the local or national level. So before creating the youth delegate program in Lebanon, we actually started by collaborating meaningfully, deeply, extensively with our ministry during the COVID, before that, and after that, in all forms, like just for consultations, or going to the media, or going to the vaccination centers and actually vaccinating people. So we did all that. So once they saw that we were actually okay, we had a structure, we are good at what we do, we know what's global health, we are good advocates, etc. They were actually motivated to include us. So it didn't take much effort from us to do it when we wanted to create the youth delegate program, because they actually trusted us before that. So just as a small tip, before aiming to create some such programs, start by the small things and create a good relation with them.
Yeah, thank you for sharing. Amazing. Yeah.
Okay, so just a minute of reflection, what has been said. I think one of the major things we face when it comes to these topics is that, as Yasin was saying, we're privileged, like here, to be able to come here. But what about other young people in the university, each one in the university? If you can think about it right now, if you cannot just ask random students who can around you, let's create a youth delegate to be along with the high level people in our country attending the World Health Assembly. They'll be like, no, this is impossible. So many young people are very desperate about achieving such things. So what should we be doing to erase this is to give more and more testimonies, which is what we are doing here right now, and share experiences. And of course, it differs from country to country because politics are different in each country and how it goes and how it comes. So it's a mean of collaborative effort, and you cannot, as Daniel said, it's a long-term process. So we cannot just say, okay, let's go and meet this person in the government and convince them to do something. I think it's a long-term process. You will get so many no's, so many maybe, so many let's talk later, so many email me. But I think, yeah, I know from someone doesn't mean it's a full no. Like we worked on so many projects like on my level that we got so many no's. And sometimes we were going higher when we're getting no's. And the people at higher levels are more understanding and they have the power to say yes. Sometimes when you talk to, let's say, a director in the ministry itself, they will say no because they will say, okay, they don't have the decision-making power at this moment to say yes for you. And they will say no because they have a lot on their agenda and they know that the minister is having a lot on their agenda. Maybe they don't have that good dynamics with the minister or the head of this thingy. So try to go higher until you reach the person who is with the decision-making for your request. And at that moment, if you convince this person will be easily able to make effort to make it happen. Thank you.
And who are you?
Yes, from my
Thank you. Okay, I see. We'll take you as a last hand. Here, another. Two last hands, and then we'll move on.
Okay, so hi everyone, my name is Hamad. I'm the second Lebanese youth delegate. So just like to follow up on what Danny said, after we made it, and after hopefully all of you will make it, please don't forget that the ones that are still trying to get there, once you're at the table, try to advocate for other youth to make it as well. We are from a country that made it. We're trying to advocate within our own region, with the other member states, and approaching ministers, approaching other delegates, hey, why don't you have your delegates in your delegations? This is really important because once they see other youth delegates who have made it and that other delegations are including them meaningfully engaging and they're actually doing a lot of great things there at the table, they will be more and more motivated to actually start thinking about it and it will make it easier for other youth delegates trying to initiate such programs in their countries to actually achieve that. So that's a great story to always help others. Thank you.
Really agree. Thank you for sharing that super important point. And thank you also for stepping up and doing that. I think the Lebanese youth delegates actually spoke this morning in an MRO meeting where they underlined the importance of youth delegate programs. So they're walking the talk. So thank you for that, Kevin.
I'll give you an anecdote from when I qualified as a youth delegate. I was working as a volunteer with the International Society of Doctors for the Environment 27 years ago. And I was involved in WHO Euro in the negotiations towards the protocol on water and health. And the trick I used was that I made interventions often bringing a compromise between member states, bringing a solution for where they got stuck, which made them starting to listen actually, oh, the guy back there, when he comes with something that could be helpful. That opened the door to bring also our own position, which was very unusual. They took me then on the drafting group of 5 people actually drafting the text as an NGO delegate, which is not really what you can expect. But my main point here is superb all the efforts you make to have youth delegates program, but they're only worth as much as you bring content into it. Focus on the content, on the impact that you have with those engagements.
Definitely. Thank you so much for that important point as well. We're going to move to the next question that I want to ask the panel. So this is about challenges and barriers, because I think we've talked a lot about now inspiring examples, but a lot of it in the room might have also experienced barriers. So I would like to ask each one of you. Oh, I like it actually. Can you share a barrier and an approach that you would recommend in that setting? And I would like to ask each one of you to give an answer on that. So maybe, Hamaya, can I start with you?
Sure. So I would say one of the things we have been talking about, not forgetting about the youth, but I would say one of the biggest barriers that young people face when getting involved in spaces like this is finances, because that is one thing that, of course, you are coming from a very good place where you want to advocate for these things, but everyone needs a support system, and that support system also includes financial resources. And unfortunately, a lot of the times, one of the biggest barriers that you come across when you're advocating for national youth delegate programs is just the commitment that does not exist from different member states to put money into these programs, because of course, it is another level of responsibility, and also something that comes with the idea that it has to be sustainable. So they cannot bring young people for 1 year and then they run out of budget. So they would stop bringing these young people again. So finances are one of the biggest things. And to answer your question about what can be a solution is, I think as young people, we come with the idea, or people assume that we are innovative. And I think we can practice that every day with our approach. And I was just talking to a colleague the other day, and they were talking about they actually raised funds, they applied for grants and different kind of things to be able to get that seed funding that was required for them to establish their presence in these assemblies. So basically, ideas like this exist, but it just depends also on where you're coming from. So I know for a fact that the European continent has different grants that are just for youth leadership or improving young people's engagement. But if there's a continent like, for example, Southeast Asia or West Pacific, it will be another challenge for them to secure these grants. But this is one of the solutions. And the other thing is also the buy-in that you can get by being good advocates. So you saw many examples of successful youth delegates just now, and it just is a skill that you have to improve and you have to build in yourself in how you would make the stakeholder buy into your idea. And the idea is a very big one. It just depends on how you would sell it to them. And another barrier I would, if I may take the liberty of saying that, is a lack of mentorship. So of course, all of us here, we had mentors through different constituencies or our schools. In IFMSA, we believe a lot on peer-to-peer mentorship. So a lot of our mentors you would see are in the same class as us or in the same sphere of work as us. But these mentors help you find your ask. Sometimes you won't even end up doing the same thing as them, but it helps to have those mentors. And a lot of young people don't have those things. So it takes them a long time to even get the idea or even be involved in these spaces. So finances and mentorship, I would say, are one of the biggest barriers and that need to be overcome.
Thank you so much, Audrey. One barrier and an approach.
Okay, I'll give it to one. I think one, I don't know how many of you are in those group chats. Every time it's with a lot of views, and then they always ask, does anyone have a badge? Does anyone have any accreditation? To a lot of like meetings, for example, like a UN EcoSoc Youth Forum, I have all these group chats that people are asking, how do I get a badge? Like, how do I get accredited? And we're just asking around, of course, like finance is an issue. Can you get there? But the thing is, can I get in? So if I can get in, and what can I do? Then you keep asking. Perhaps like one thing I want to bring you back is how important it is to like help each other. We're in a community that we are all trying to advocate for youth. So for example, what we also do in IPSF is that if we know that there are like up to 6 badges that you can use, like you think that you're only going to send 2, then you actually have more badges. Like maybe someone asked, maybe you can also like register them as well. Then we can actually together bring more youth to this. Or like maybe, it's not real long-term strategy for that, because then you have to ask every single time. Maybe like there is a way that if you're already accredited, the way to get in, like how you can actually help the other organizations. That way, maybe we can actually bring more youth to the table. So I think that would be like the solution going forward. But hopefully with more like financial and mentorship, that type of support as well, then we would have like a better path to know how we can actually get in from a different ways.
Amazing. Thank you for sharing that. Marcus, can I move to you now?
Yeah, just keeping it to one. Okay, so maybe I'd go for tokenism. You already know that many people like would include you, but then not really. It would be like just for the image. So like we have a youth delegate, or we have someone. Like it happened back home. I think I would not state where exactly, but somewhere. And like it was like something that was in the rules that they have to have a youth delegate, but they didn't know how to choose one, and they didn't really want one. So they came to, let's say, me, and they asked me if I would like to do that. I said, yeah, why not? But why don't you like just open a call to check how many people would be interested, and to get an idea about their background and what they would bring to the table. And they would like quite reluctant about it. So it was like I had to accept the opportunity and just like be the channel between this platform and the other platform, which are like the Association for Medical Students. And it's quite like interesting to see this same mindset from, I think, 2015 still going on. Even though many young people like try to like not just in medical school where I studied, but in other schools, not just the medical field, trying to do the same. And it's like quite interesting to see the acceptance coming just from like international institutions saying that you have to have a young delegate there or in that meeting or that thing. Otherwise, from the inside, the mentality it's a bit still like has a long way to go forward. So that's a challenge from like the core of what tokenism can look like. But the way forward, maybe it's the intergenerational dialogue on all tables and at all levels in all fields. If like the seniors would like set a table like this one and like have a one-on-one talk and see what the other individuals are doing, they would be amazed. And that's what happened on several occasions when I was back back home. But then this goes to the list of challenges can go further to, like the financial one, the visa one, like it goes on and on. Yeah.
Yeah, thank you for sharing. Ctre, can I move to you now?
Yeah, so I definitely agree with everything that the other panelists have outlined. I think the most obvious issue would be the visa, but I don't think even WHO has a solution for that. So besides offering each other support and invitation letters, there's not that much that we can do that is in our hands. So I will instead point out to a barrier that we perhaps pose onto ourselves. And that is that we oftentimes, when we exist in these same spaces as everyone else, we start to use the same language as them. And the thing is that we shouldn't do that, right? We're young people. We should point out the issues that exist there without using the language that is overly politicized or using all these big trendy words that you can basically, for every statement that you hear in the Palais, could almost like play bingo with, right? Because you will hear sustainability and political will, et cetera, practically everywhere. So what you can do is you can be very direct. You can be energetic with your approach. You can be an interesting counterpart in a dialogue, someone that is interesting to talk to, someone that has a different perspective than anyone else in the room. And I think probably Gaudens and Doreen can confirm that the youth council is definitely not boring whenever we chat together, because we try to bring in the different perspectives, something that is perhaps not has been noticed or outlined or pointed out before. And I think that is the role of young people when we are here. And the barrier that we pose to ourselves is that we say, okay, our statement might not get accepted, so we use the exact same language as everyone else does. And then the statement is just like, doesn't really make a lot of impact. But if you make it, direct, you make it really like that, it outlines the issue that you would like to highlight, make it really, really strong, use youth language because we are young. So that is our strength. That is what's going to bring attention and focus to the issues that we actually advocate for. So for anyone who is like either a part of national delegations or a part of non-state actors, double check your statements or double check whenever you like speak with anyone at the Palais, at the side events and so on, what makes you different from anyone else in the room, right? And play onto that, use that as your strength, make yourself interesting so that the conversation will go on for longer and you can bring in that youth perspective to really shine.
Yeah, thank you so much. And for that clear way forward as well. I would like to ask if there are two people that would like to share an extra barrier with us. Also, just want to share the exciting news that after our session, we're getting closer to the end, there will be a great reception for everyone. I'm also checking online. So if there's anyone online that would like to share a barrier that they have experienced, please do raise your hand because we would love to hear from you as well. And I think I saw someone. Yeah, go ahead.
I want to share a barrier which is related to political and economical situation in a country. It always affects youth in general because they're vulnerable in their own country, especially in some LMICs. Being able to adapt to what you do and to adapt the international standards and to adapt the inspirations that we hear from other people, youth like you, in the world, to adapt it to your situation is a big barrier, and it needs a lot of it needs a lot of competencies and also knowledge about the situation in your country.
Yes. Thank you for sharing. I think very important point to add to the conversation here as well. I don't see anyone online yet. But I think a lot of very important points have been mentioned. So if I might add one myself that I have experienced, which I don't know if you will resonate with or not, but you might, is that I think in many instances, I myself experienced myself as a barrier, telling myself in my head that I'm not an expert enough, I'm not important enough to be part of these places, to speak in this opportunity. And even now, being part of the WHO, I'm one of I'm the youngest on the team. So sometimes my head goes, oh, should I be saying these things? Should I be doing these things? I don't have the experience that these people do. And I think this is something that we as young people should also very much realize and talk about with each other. Or I would encourage you to do that if you so wish. Because I do believe that all of us have a very important voice, have a very important expertise, experience that we can share. And so I would like to encourage you all to do that when you can and to use your voice, even though we sometimes tell ourselves that we might not be good enough for that. I'm telling you all now that you are, and I hope that you can also tell your voice that you are.
Yes.
Can you go a bit closer?
Yeah.
Hi everyone, my name is Abdul. I'm an IFMSA alumni and I'm a member of the Junior Doctors Network. A barrier that I noticed while I was a student is kind of like a barrier for all the young people. We have our studies. I mean, it's a simple thing, but in order for us to be here, like we have to go to university, and some study medicine, some study something else, but and then we also have to focus a lot on our studies, and that makes it not possible for a lot of people not to be here, even though that they want to be here because they're putting so much focus on their studies as well. So it's also remembering that there are a lot of things out there, but also the simple things such as our studies is a major barrier as well sometimes. That's it.
Thank you so much, Abdul, for sharing that with us. All right, so we've heard about inspiring examples, we've heard about why it's important, we've heard about barriers. We have some time left. I would like to ask, is there anyone that has a question for our panel, something that you would like to know from them? And again, I'm also checking online to see if there's anyone that has a question online. Please do raise your hand, and we will give you the floor. If so, we would love to hear from you as well. Yes.
Did I stand the front?
That would be great. Yeah.
All right, just let me get out. So, hi everyone, this is Ctre from RPSF. So I think my question is somehow very crucial, I believe. I think everyone in this room, there was a moment that when you try to approach someone or when you try to talk or try to represent youth, you feel kind of intimidated. Like you feel afraid that you may say something wrong or you're not going to be represent the whole youth, or you might just not be listened to. So, and I think like even though there are a lot of opportunities for youth already, there's still a very long way for youth to be really engaged in all the policy making sessions or shaping our own future. So my question for the panelists is that, how do you keep that kind of passion and motivation or inspiration to help you keep going on to fight for youth? I think that is something we really all need, so we can keep working on it and bring a better future for our own generation. Thank you.
Thank you for sharing. I think Audrey, I saw you nodding. Do you want to take us away on this one?
Yeah, I think like it can definitely be very intimidating. Sometimes it's like we also told my delegation as well, like, you know, you're going to a side event, you know who you're gonna talk to, like you might just bump into like a minister of health. I think that like Katja mentioned, it's like we're just youth, like you can be direct, you can ask your questions. I think from their side, they probably would expect that, yeah, they're probably gonna ask this type of questions after they have talked to so many youths. That part, I think I'm kind of just know that, yeah, you'll have a lot of rejections. Like I was just talking to Yipan as well. We have this career fair. We talk to maybe 20 to 30 sponsors and all know before we find one, but you know, you just keep going. But at the same time, you know that it's not only about getting seen and heard, it's also about you like growing your own knowledge to make sure that when you have that opportunity that you make that contribution, you have that like an intervention, it is current, is like relevant, that it's going to be at the good place to like say what it is. So I think that it's like keep motivating you. Like it is not this time, it's going to be next time. But when next time comes up, I'll be ready.
Thank you so much for sharing that. Maybe Katja, I can ask you to comment and then we'll move to the next question from online.
Yeah, sure. I mean, besides obviously having a certain goal that like brings you here, because probably everyone in this room has a favorite health topic that they advocate for, whether that's climate change, SRHR, NCDs, whatsoever. Like that is really good. But for example, I would also say sometimes like, you know, the personal traits that like really like push you to do your best. Like, for example, for me, when I hear like people like tell me, no, like we don't need youth on this panel and so on. Like that's where my stubbornness and competitiveness is gonna kick in, and I'm gonna, you know, like push for more. But for someone else, it might be a different kind of approach, you know. So try to utilize what works for you to bring out this like motivation and passion, that something that really like kicks you to do more, even more. So try to like kind of combine, because obviously like you know what you're going for, you have your passion, you have your interest, but the approach that you take is something that is very personal to you. So just see what fits you the best, what feels most natural, most comfortable to you. Again, be direct, be refreshing, you know, and then just go for it.
Great. Thank you, Katja, for sharing that very inspirational intervention there as well. Mustafa, online, would you like to ask your question?
Hello everyone. Am I audible?
1 second, we cannot hear you yet, but we will be able to hear you very soon.
You can go on.
Okay, am I audible? Okay, thank you so much, everyone. I am Mustafa from the IFMSA, and thank you so much for sharing your insights on meaningful youth engagement. And my question is for all panelists, which is, as we are talking about meaningful youth engagement in global health, I wanted to ask, how can you measure and evaluate the impact of meaningful youth engagement in global health, and what usually are the indicators that can be used to assess its effectiveness?
Yeah, thank you so much, Mustafa, for asking that question. I think also a very good one. And I saw again one of our panelists nodding right away. So Hamaya, can I start? With you?
Sure thing. So I would say impact while being an advocate is something that is very subjective and sometimes very hard to track because unlike a lot of things that you shape into creation, advocacy is something that is endless. There's always something that you're gonna advocate for more. And as I was saying, the trajectory of moving from youth participation to engagement to youth partnership, I'm sure that a lot of our predecessors would not even have thought of these outcomes and how they would ever track them. So I would say in that way, it is something that is a challenge. But then there's also things that we are fortunate enough to see that come into fruition very quickly in front of our eyes. So for example, you reach out to some person in a very important position in your country and you ask them to commit to providing young people the space to advocate for NCDs, or young people are part of the process of making that policy for NCDs or something like that. And you see immediately that young people become a sustainable part of that workforce that helps create those policies. And as our Lebanese youth delegates were saying, that you become involved on a national level, and then you keep seeing that you're getting more and more calls and they're asking you to come sit in their panels, or if they're creating a workforce and they want you to be one of their lead workers or technical force. So basically you're seeing that your value is increasing, and that in itself its impact, because they're trusting you to contribute to something that will essentially be the tool that will provide the care or the outcomes that the ministry or the government wants. The other way to track, I would say, impact is also programs like the youth delegate programs that I think are one of the most direct ways in which we track our impact, especially within IFMSA, because each year we keep track of how many people reach out to their member states. We keep them as a record, and then next year we see if we can build the connection again, and sometimes we just see these youth delegate programs come into fruition in just a matter of few months. The other way to impact track is, I think, also regarding personal expectations. So every person who comes to these spaces has personal expectations in what they think this sphere could give them. It could be something like you going back to your country and creating a youth coalition that is just working exclusively with the member states. But then it could also be that you are wanting to be in this space to contribute to the policy so that you can go back and be a better doctor and provide the contribution to the policies. You understand that side of things, but then you're also an excellent clinician. So it depends on how you are measuring the impact. But I would say the biggest thing that it comes down to is who are you engaging as a stakeholder and what kind of engagement you get. That is the impact. And it doesn't matter longitudinally how you measure it or what are the measures. Is it quantitative, qualitative? Is it mixed? I won't say there's a limit to this or any specific way of measuring it.
Thank you so much for that answer. And I think shows right away that Hamaya is definitely a researcher as well. But thank you for sharing that, I think, very in-depth answer. Bacchus, do you have something to add to what she shared?
Yeah, talking about research, I'm I'm a big fan of numbers and data, so maybe that can be a way of evaluating things, and having also the quantitative thing of it, so having the feedback from the people from the delegation on how they perceive the youth delegates and their inputs during the meetings they are taking part of, such as WHO, for example, the Lebanese. I don't know if they're still here. Yeah, but maybe you suggest that to your ministry to have their evaluation on your being there with them, how they perceived it, and vice versa, and this can create data for analysis. Yeah, so
Great
it's
ideas.
one of the ways.
Thank you for sharing that.
Yeah.
Mustafa, you asked the right question of impact, but the word of caution on the measurement, because policy making is often difficult to measure. So go for the qualitative as much of the quantitative. Because one danger I see that you then jump to what is measurable, which is usually an output or an outcome. So the number of youth delegates, the number of statements, and so on are outputs. They are not the impact. The impact should be health. But I still give you somehow the value chain that you have just been experiencing. Several of you were relentless in making pressure and in pushing us that finally we have the Youth Council. The Youth Council and the attention Tedros brings to it shows to member states, oh, that matters. That motivates member states, oh, we want to be seen as part of that movement. So more of them take youth delegates, but then also go for that. Some of those where you are youth delegates, that they say to colleagues, actually, we just wanted to be seen having a youth delegate, but that's so useful, why don't you do the same? So think of the qualitative part of the quality you bring to the debate and not just measurements. It's very, very hard to measure. That doesn't mean you have to push for impact.
Yeah, thank you for sharing. And I'm seeing some smiles around the room, so that's great. I think we're getting closer to the end. I want to do a fun activity with you all. I'm going to challenge you. I want us also, I'm going to count 1, 2, 3, and then we clap. And I want the clap to be exactly at the same moment. And those online can also join us. So if you want, you can unmute and you can also clap. So this is going to be a big challenge because, as you know, with online, that will be great. So are you ready? 3, 2, 1. Great. All right, so we're going to move towards the closing of today's session, but I do want to mention that I think a lot of topics have been open today, and I know that a lot of you probably have a lot more to say on them. So I do invite you to come to the reception where you can meet the panelists, speak with them, meet each other, speak on these topics together, and I hope that we can get more action done and move towards meaningful youth engagement together even further, as we are in the current momentum. I would like to ask you all in a closing statement to reflect on what do you think the next steps should be? How do we further strengthen youth partnering and youth leading for health? And whilst we do that, if I can ask Iman, would you be able to put up the word cloud back again? So just in case that anyone would like to add anything more to the word cloud, those online or in the room, based on what you've heard, please feel free to do that. So Bauke, can I start with you?
Yeah, sure. So maybe I'd go back to how and why GDN was created, because many of us got to, like, after quite of 30 years or something, got into like big or high level positions, like in ministries within WHO and so on. And this can be like an opportunity to create bridges within like these alumni with current like youth organizations such as IFMC and so on. Having these people being part of the same organization back when they were young, and now those positions that have impact and influence, they can be also advocates for youth engagement within their countries, without their partners, and it can be a way of giving back to the starting point when they started. So we can build these bridges with them, and we can be the next ones like them as well.
Perfect. Thank you so much. Audrey.
Yes, I think from an individual perspective, I think externally towards the others, we need to be proactive, we need to be fearless, but at the same time, we need to be prepared and then keep the fire burning. Together with other youth organizations, I would say that unite, and then we will keep this movement.
Amazing. Thank you so much, Audrey. Strong call to action there. Amaya?
I would say this, I would make it a call to action that is like bigger in the sense of how you perceive your engagement to be. So just you being here means that your circle has evolved in more ways than one. So this could be a call to action to everyone here, that while you're here in Geneva, reach out to your member states, reach out to the people, even if they're not your member states, and you have a colleague who you think could be involved in these spheres, reach out to them and tell them why you being here has changed your life dramatically. Because once you're here, it is very hard to go back to not being involved in these spaces. So share your experiences, use what you have, the tools you have through social media and your networks, that is IFMSA or IPSF, YHO or JDN, or even other organizations that I think you might be part of. And also the other thing I think that could be one of the strongest things to go back to is, once you're back in your medical school, in your community, try to see how you can engage other young people, share your experiences with them. I know in IFMSA we have a different kind of didactic program, and IPSF does that. And YHO, like all of us have some sort of a informal peer-to-peer learning mechanism that you all can take back home and help create like an army of young people who really understand what they deserve and basically go and fight for it. So that would be my final remarks.
Amazing. Thank you very much. Ctre.
I would say use all the pieces of advice you get, not just during this session, but during the whole week of WHA, because probably you've heard from speakers, mentors, fellow young people around, a lot of different tips and tricks, and just combine them. One thing that I would say is that try not to just go for what you want, but also see what your senior counterparts might need and see where those intersections are, so that you can start pushing from bottom up. And then as youth council and any other mechanism out there that exists can sort of push from a different direction, so we can meet in the middle and really see the impact that that exists there. But just in terms of a practical call to action, what I want to see next year, whenever we hold a youth engagement event, I want to see member states here. So I want every single young person that will attend the event next year, whether they come here from a side event, from the Palais or wherever, to grab the hand of an older person and just, drag them to the youth event, that we really get the voices, we get the representation, and that we don't close this as a bubble, but that we really raise awareness towards the people that actually need to hear why youth engagement matters. Because obviously all of us already know something like this is important.
Yeah, thank you so much for those inspiring words. And I would also like to give the floor to one of my colleagues, Doreen van der Wel. She has been working and pushing for youth engagement within the World Health Organization for a very long time, and would like to give some closing remarks to you as well.
Yeah, just first of all, I really want to say it's just incredible what I've seen this week in terms of commitment, in terms of perseverance, because I think everything that we've heard here today comes really down to perseverance. When you're passionate for something, it's not enough, but then you need perseverance in order to really keep going and keep pushing. WHO, as what I've learned from these young people, it's a youth council. It took a long time to get the youth council here, thanks to some that were in there that kept going, and kept going. And afterwards said, places like WHOs are really hard places to get into, are really close, they're like fortresses. I never realized being at WHO that this is how young people or how certain constituencies would see WHO. So that is something as well, I think, finding the people within the organizations that are willing to go with you that extra mile, that are willing to bring you in, that believe in you, and that actually can help you create those spaces like the Youth Council, because Dr. Taylor has given the Youth Council, provided you space and credibility to the member states. It will make them actually really listen to you. So I think it's really important that champions on your side in the organizations that you want to work with. And then I just really want to thank all of you, and especially colleagues from Youth Councils who've been, we've been doing so much. And I realized doing this next to your studies, this is huge. I think we often don't realize that you do this on top of everything. So I really congratulate all of you to have that passion and the willingness to do that. And last and least, I just wanted to say, for all those that are not familiar with WHO, probably some of you are, most of you are, we do have a way where we can engage with your constituencies. And happy to talk to some of you who are interested in it afterwards, whether it is through webinars, whether it is through career sessions. whether it is just simply having seconds to learn what we do with WHO, how we function, what our challenges are. We're not a perfect organization, far from, but the mandate of this organization in global health is amazing. And the imperfections, we have to deal with it, and learning to navigate in those organizations, and learning to navigate across, these global health governance systems is not easy, but find the people to help you do this. So thank you all for being here tonight, and all those that have set this up. You've done an amazing job, and thank you, Iris, for moderating so well with that.
Well, thank you so much. And I think that's the perfect introduction to our reception. I would also, from my side, really like to thank the organizations that have been hosting us. First of all, University of Geneva, also for providing us the room, for supporting us in organizing this session. We have the International Youth Health Organization, we have the International Pharmaceutical Students Federation, International Federation of Medical Students Associations, and we have the Junior Doctors Network of the World Medical Association. I hope you really appreciated how fast I said all of those new names. I would like to give a big shout out to the panel for being with us today, to Gallians for opening our session today, for Doreen for her intervention. And finally, I would like to congratulate all of you for your incredible efforts. Thank you for joining us tonight. And I think you've heard the call to actions. So once we get back into those side events, World Health Assembly, whatever we're doing tomorrow, we know what we're going to do. And now I hope that you enjoy the reception and exchanging more with each other. Thank you all for coming. Yeah. Maybe I will touch it. We can
Oh, nice. Those are cute pictures.
Yeah.